Welcome to the Neurostimulation Podcast. I'm Dr. Michael Passmore, Clinical Associate Professor in the Department of Psychiatry at the University of British Columbia in Vancouver, Canada. The Neurostimulation Podcast is all about exploring the incredible world of neuroscience, clinical neurostimulation, interventional mental health, and general mental health and wellness. We explore how the brain works, the latest research breakthroughs, and most importantly, how that research is being translated into real-world treatments that can improve health and well-being. So if you're a healthcare professional, a student, a researcher, or someone who's curious about how our brains work and what we can do to help them work better, this podcast is for you. My mission is to make the science accessible, inspiring, and relevant to your life. This podcast is separate from my clinical and academic roles and is part of my personal effort to bring neuroscience education to the general public. Accordingly, I would like to emphasize that the information shared here is for educational purposes only and is not intended as a substitute for medical advice. Always consult with your healthcare provider to discuss your specific health needs and treatment options. Welcome back to the Neurostimulation Podcast, where we explore the frontiers of brain science, mental health, and human potential. Today's episode is a particularly rich and multidimensional conversation, I'm hoping, and it's one that is going to move beyond simple symptom reduction and into the deeper question of really what it means to feel whole and full of vitality. I'm joined today by Dr. Nora Nneka Ekeanya, a psychiatrist, a writer, and a truly integrative thinker in mental health. Dr. Ekeanya brings a unique perspective shaped not only by her clinical work across things like inpatient care, community care, and even forensic settings, but also by her lived experience as a client and her creative work in the arts, things like poetry, visual art, and super interesting to me, this idea of narrative medicine. And so her work sits at the intersection of psychopharmacology, creativity, spirituality, really exploring we can try to encourage clients, especially high-achieving individuals, from simply managing to survive with perhaps simply from surviving and perhaps coping with residuals to thriving, having a deeper sense of things, identity, purpose, vitality, self-actualization. And so I'm really excited to explore all those interesting topics and more. Dr. Ekeanya, thanks so much for being here. Welcome to the podcast.
Thank you for having me to be having this discussion.
Yeah, so am I. It's just so interesting to get familiar with your background and all your current work and your projects. So perhaps, you could just start by introducing yourself to us and talking a bit about your background and what's brought you to where you're at today and the kinds of projects that you're excited about currently.
Yes, thank you so much. So yes, I creatively go by my first and middle name, Nora Nneka, but Dr. Ekeanya. I'm originally from Florida. I was raised by Nigerian immigrant parents, and really, my early childhood was very traumatic, but I was motivated by wanting to be a physician. I knew very early on that I wanted to be a doctor, and like most people, sort of that at least gave me some stability to get through the trauma. But what happened is I went to medical school, and it was the first time that I was away from any of even the chaotic people in my life. I was just around no one. And that's when my mental health really suffered in medical school. And so for the first time, I wasn't a straight A student. I wasn't eating, and it took an intervention from two deans at the medical school on my behalf to really honestly save my life. And I was officially I was forced, really, if I wanted to stay in medical school, I was, forced to get help, to seek treatment. And so my interest in being a physician and my interest in being a doctor, because I like talking to people. And I think as a survival mechanism, I learned very early how to read people's cues and become interested in how people are thinking because I had to, you know. So that interest already led me to psychiatry. But what really gave me a sense of meaning and purpose was going through mental health treatment myself, going to a therapist, processing my own traumas, being on medication, knowing what that feels like, to not be like yourself and hoping that a pill is going to help you feel more like yourself. What a radical idea. Um, and so, I've met my husband in medical school. And so I went to residency in Kansas City. And I really, now I look back on that and know that I did not want to be in Kansas City. I kind of like acquiesced because it was, it was something good for the couple, right? But it didn't really feed my spirit. The place didn't feed my spirit. Um, but it was a good residency program. And that's when I started to dabble more into a previous like practice of writing. As a child, I wrote poetry and essay, and I've always been very lyrical and musical. But I was always taught that you need to separate that. If you wanted to be a doctor, you need to be professional, and professionals aren't being whimsical and having notebooks of poetry. But I really had that urge to write again because now I'm found myself in residency and in a place that I really didn't physically align with. But I did it as medical writing. So I started writing these nonfiction essay from the perspective of a Black female physician. So that's how I started feeling comfortable, getting into writing again. And I was getting paid for it, so it's like, this is, 2014, 2016, I'm getting like $200, $300 every essay, and I can push out an essay profusely, and that was how I supplemented my income initially. And then as I met more, because I'm creative, I would meet friends who are creatives. And in Kansas City, because there is sort of a vacuum of things to do, it allowed me to play. And that's how I really got back into being comfortable with art, is that, residency was residency. I knew I wasn't going to find my best friends there. I've always been sort of the strange one, like among the strange people, right? Like as psychiatrists, we tend to all be sort of like the weird ones of the cohort, but I'm always the weirdest of the weird ones. So I've always sort of gravitated to artists and sort of left medicine at the hospital. I pop in as a fairy and pop out. And so as I made friends in Kansas City who are artists, just out of pure boredom, we would collaborate. And so this is how I expanded myself creatively from writing. Because once you identify yourself as a writer or creative and you pick a medium, people tend to want to pigeonhole you into that medium. But I, as a creative, believe that we are all creative. It's just how much do you want to push yourself? What are you interested in, and how much do you want to grow? And so that was, and so it started out with photography, and my friends who are photographers need to test equipment, and I would have ideas that I would want to bring to life. And so that we would collaborate visually, because I would write essays based on the visuals, you see. And then I started filming these things, and then it built into poetry because I would work with friends who are cinematographers and they wanted to play in that way, and I joined collectives. And so in these femme collectives, we have makers, you have creators. So creativity became a full experience for me, being in this vacuum of Kansas City while continuing to process my trauma, because I started therapy in medical school, but it really continued. It's a thread that's always continued because I had so much to unpack. And so initially it was, don't kill yourself in medical school. What do we need to process to keep you, safe now? And then you can go into more and more. And as life changes, right, we know the benefits of kind of revisiting and saying, hi, I just got married. I need to process what that means to be a wife or a husband or a partner, So that's how it kind of wove into the art, sort of the medicine, the medicine wove into my art. And as a psychiatrist, I see you have these interesting cases that you can't talk to anybody about, and you want to express to people like the things that you're noticing about humanity. And so then I started wanting to write about my experiences with people, it like the thing that gave me meaning grew, and it has bloomed. I don't know what's coming next, because right now my big focus is integrating myself. continuing
Mm.
this journey, being the artistic psychiatrist and owning it, not being the weird psychiatrist who is an artist, not being the artist who kind of whispers, yeah, I'm a doctor, like you don't need to pay me for this. Like I just want to have fun,
Mhm.
I
Mhm.
want to be both. I can be both. I should be both, because I've just found that that's the thing that I see help other people is the thing that I also need. So in launching
Mm.
my private practice and really, expounding on integrative psychiatry, that has been that's been my growth journey. Creatively, I want to paint, but that will come at its time, when it happens, as it happens. Um, but this is a part of my creative journey as well. Yeah.
Well, yeah, it's amazing. Thanks so much for explaining that. And I think it's just so inspiring because, clearly you have a real passion for it. And it's just so heartwarming to see how you've been able to get to where you're at and just be able to live in a way that is bringing together these two really important aspects of your vocation. So the medicine, the psychiatry, and the art. And there's a few threads that I thought it would be interesting to pick up on that. The first one has to do with this idea that I think physicians, I mean, it goes way back to I guess maybe was it Hippocrates that,
Mhm.
it's no physician, know thyself or physician heal thyself, right?
Yes.
I'm getting the Oracle of Delphi mixed up with Hippocrates there.
But
So
yeah, yeah, yes, I
physician,
did. Mhm.
heal thyself, right?
Yeah.
And this whole concept of maybe more contemporary writers like Henry Nouwen and Viktor Frankl talking about the wounded healer, right? And how having
Mhm.
some sense of that and some vulnerability and
Mhm.
exploring one's own trauma. One of my great mentors in residency
Mhm.
said something that just struck me to the core it was kind of an offhanded thing, really. It wasn't even something that I think he intended to emphasize, but he just said, and it really quietened down the room because I think it had an impact with all the audience members. And he said, we're all traumatized to a certain degree or another early on in life, right? So I think that knowing that and to be comfortable with being vulnerable about that is really important, I think, for caregivers especially. So
Mhm.
so thanks for explaining
Mhm.
that aspect of your story, and it's really inspiring. And then the other thing that I thought would be interesting to touch on as well is just how exciting it is for me to see you talk about your passion for bringing together the arts and
Mhm.
medicine, because surely they talk about the art of medicine, but I think in school, as you're alluding to, it's very true that they kind of just give lip service to that, right? And
Yes.
if you want to try and explore an artistic kind of thing, it's sort of like on your own time, and it's not really well accepted or encouraged. But I think truly the best clinicians really are artists at work, in undercover artists, shall we say, right?
Yes, yes. And I arrived to this knowledge, this knowing that as a healer, we also needed to be healed people through the mentors that I had in residency. I was lucky enough that in the same physical building, we had acute units, we had state chronic units, forensic units, an emergency room, and a psychoanalytic institute of Kansas City was actually based in the same building. And so it, we had a lot more daily interactions with psychologists who really wanted us to put a mirror to ourselves for the first time, and in doing that, the thing that cracked me open was actually Viktor Frankl's Man's Search for Meaning.
Mm,
That that is a book that I read every time that I have an ego death, because how sweet of an irony that he found meaning in thinking about other people's thoughts, in being a psychiatrist, and you know what I mean, and and the thing that he enjoys, right, gave him meaning. It kept him alive. How beautiful, right? How
mm,
beautiful. And that's the emotion that I like, I want to sit in, because that's what resonates with people. The patients that click with us, they click because we are also human. We are human guides, right? We are not gods. And I think as psychiatrists, but like particularly, that's why I don't get offended when people sort of mix psychiatry and psychology. I just kind of like correct them and say I do medications, and there is a
mm,
scientific component to it that is more rigid, but
mm,
on the spectrum of physicians, we sit in that liminal space more often. It really is. There's so much of
Mhm.
mental health that is this in between. And what bridges that gap is knowing that we are also humans in this lived experience, living the experience with them, the third. You know what I mean? That third needs to be healthy. And for the health, like that third space to be healthy, we must also embody that. I think also that's why there's such a crisis in mental health right now, where there's a pushback against psychiatrists. You know, everybody, you'd rather see like an untrained nurse practitioner than a psychiatrist, because psychiatrists is burnt out from the pandemic. We're burnt
Mhm.
out from just healthcare as it is. I mean, as a psychiatrist, like I don't know about you, but like, you know, I remember when the shift happened, when everyone went from being like, oh, you must be weird or dumb, and that's why you became a psychiatrist,
Totally.
to it being like, you know, the like you are the a top echelon, and people are fighting to get into psychiatry residencies. People are fighting to get into the doctor's office. And so a lot of psychiatrists who weren't trained to think of their own selves really overgave during the pandemic, and they burnt themselves off. And so I would see a lot of our colleagues who are zombies. They just
Mhm.
they're working through life. 15 minutes. Are your meds working? And because they are so, exhausted emotionally and not keeping track of that, they have nothing to give. And so we piecemeal it. We say, I do your meds, you talk to your psychologist, and then your psychologist says, okay, you need a social worker. And then the social work, do you see what I'm saying? And that's how
Mhm.
piecemealing mental health treatment. And it's like, how vulnerable can you be truly when you're in the crisis? How many
Mhm.
times can you share with someone, a different someone, and hope that they get it and hope that they can help you, and that they don't just give you a link or a number or a thing? And so this is sort of the shift that I've seen. And I know from my own experience that art and medicine, there is a role for it, as an artist. But really, I came to the knowledge of it just going through like research studies and stuff, kind of looking up, um what happens neuroplasticity wise, what
Mhm.
happens, when you integrate art and medicine. And every time it shows up that, like, for high achieving people, you need there's a certain thing, I'm gonna like find it, it's a certain phrase that I wrote down.
Mhm.
I like to tell it to patients, that the synthesis is that like medication stabilize the circuits, right? Psychotherapy,
Mhm.
it it reorganizes your cognition and gives you recognition. But spiritual practice give you meaning. Spiritual
Mhm.
practice gives you perspective. Creative practices, give you flexibility, you know what I mean, in a way. And so these are easy and intuitive ways to lead people away from, I need dopamine, let me go smoke a cigarette. Instead, say, do I need dopamine? I'm going to go dance with strangers, right? I'm going to move my
Mhm.
body. I'm going to go scream, right? um and also something that, because I work with a lot of people who have, PTSD and trauma, something that I realized is that in processing physical, like some somatic therapy is very important for processing trauma. And so I would find myself taking walks. Okay, this is a secluded area where we can walk and talk. Do you want to go hiking? Do you want to go biking? And I found that, like, just being, it allowed people to process, versus sitting and just reporting, and then you have to worry about all these barriers. um so yes, I kind of go back and forth with that, but I really do think that for us to survive in mental health as psychiatrists, medical doctors working in mental health, we are going to have to go back to honestly what everyone thought psychiatry was during that Freudian era. It really was just because, like, they hadn't subspecialized and there's not a lot, you know what I mean?
Mhm.
But the value of that time, that era, was that your psychiatrist did everything related to your mental health.
Mhm.
Everything. They managed all aspects of it. They didn't piecemeal it out. And so for us to survive, and we need to bring it back to that. We cannot keep, like, subspecializing and subspecializing, and I only see anxiety and I only like Zoloft. I've met so many doctors who have favorite medications, and it makes my heart so sad. Why do you have a favorite medication? The medication's a tool. What's the patient need, right? So anyway, I hope that makes sense.
No. Yeah, for sure. I agree with all of that. And I mean, it is really interesting because they're complicated and challenging issues for sure. I mean, I think it comes back, like it reminded me when you were this quote, I believe it's Maya Angelou, people won't necessarily remember what you say to them, but they'll remember how you make them feel. Right? And it's not an ideal, I suppose, for psychiatrists and all caregivers to try to remember, myself included, for sure. I'm at the top of that list. But yeah, it's because, I mean, and I think that burnout issue is a really important one too, to be really highlighting, because burnout, again, and I'm at the top of the list with this too, and compassion fatigue, and feeling like you just need to get through the day, and seeing medicine as more of a job that you just have to get through to pay the bills, and one client to the next, and then by the time you're halfway through the afternoon, you're thinking about getting home as fast as possible, and what's going to be in the fridge for supper and all that kind of thing, right? And so, I guess it comes down to balance to a certain extent. Obviously, there are practical aspects of work that you have to take into account. But what strikes me as really inspiring and exciting, though, is this idea of integrating art with medicine and clinical work. It doesn't have to be medicine, but caregiving, shall we say, in a way that fosters a sense of play. Maybe is that part of it, because that's restorative, that's inspiring, and that'll hopefully help to counteract the mundane grind of day in and day out kind of work that probably engenders caregiver strain, burnout, and compassion fatigue, right?
I agree. And that's how I live my life is, those tiny moments of whimsy, of joy, of connection that I can make, or what feed me to feed other people. And it grows. And so, and you can, it's in small ways, it's in little ways, and it helps humanize us. I feel I'm one of those people that, when I would have a bad day, I would tell my patients, like, hey, sorry, I have been a little grumpy, like my toddler woke up, like it sucks. So if I'm not myself, I'm not myself. And they say, oh, that's fine, you're a person too, And so in humanizing myself and adding fun, I used to hand out candy, just secretly, or dance with the patients. If they're doing expressive therapy and they're dancing, I'm gonna go dance with you. When I was doing inpatient, those tiny moments are the moments that really do feed your spirit. And those are the moments that I remember, and I want to remember it all. I want to be able to savor, when I cannot move anymore, my goal is to savor the memories, one of my favorite moments, and it inspires my art too. So I had a patient with catatonia, and it was pretty bad. He was in the hospital for a better part of a month, right? But as he improved, the one thing that he was really into music. So I knew he was getting better when, the shimmy started, and I was like, okay, we're moving our body, this is good. And, I grew up like a hipster kid in college, so the band Phoenix came on, and it was and I started we were outside, they were doing their fresh air break, and I was like, man, Dr. Eve back in the day, a Parliament Light and a red stripe and this song, and he got up and danced with me. And we all, it was one of those moments that everyone was like, oh my God, he's better. He's back, he's dancing, he's moving all his limbs, we are dancing. And that's a moment I'll never forget. And it's clinical because I'm like, okay, he's getting better. How much Ativan do you need, We're moving towards ECT. Do you see what I'm saying? There was a real medical imperative to get him better. But personally, I just wanted to I loved seeing him just a little bit happier. and that
Yeah,
little shimmy, and if it takes me being a fool and telling people that, yes, like I was a grungy, strange person back in the day, and now I'm a doctor, and here we are.
totally. Yeah, yeah.
That's, yes, yes. Hmm.
Amazing. Yeah, it's a real world example of something kind of like that book in the movie Awakenings, Oliver
Yes,
Sacks and then Robin Williams and with
yes,
catatonia. Yeah, amazing.
yes,
Well,
yes.
it's really so the story that you told about in residency when the psychology colleagues would, so to speak, encourage you all to hold up a mirror to yourselves. It
Hmm.
really does. I think that really is so profound because
Hmm.
again, from personal experience and seeing colleagues and talking to people, it really does, at the expense of maybe over analyzing and
Yeah,
getting too psychoanalytic. But,
right.
surely there's a reason for some of us why we're drawn into certain fields, in
Exactly.
medicine, psychiatry in particular.
Hmm.
And
Hmm.
perhaps part of that is kind of a defense in some way, I can't remember what the mature defense mechanism is,
Right. Yeah.
sublimation or something like
Yeah.
that, right?
Yes.
Um, and so maybe part of it, and part of why that struck me hard
Hmm.
when my mentor said, "Oh, we've all been traumatized to
Yes.
some degree or another." It's like,
Hmm.
oh, okay, maybe I was, and I don't really realize it, or I'm defended against it, and maybe that's why I'm in
Yes.
psychiatry, right? And
Yes.
so having some vulnerability, some insight into that, and being
Yes.
willing to be vulnerable and engage in some self-exploration, or with a therapist, right,
Hmm.
or in a
Hmm.
group,
Yes.
can be super helpful. And I wonder if perhaps maybe I'm going on a bit of a limb here, but I'd appreciate your thoughts about it. If that kind of dynamic in general is extended from individuals to more of like a collective or institutional phenomenon that has contributed to psychiatry kind of overcorrecting towards objectivity and being detached from patients and being overly concerned about boundaries, and
Hmm.
siloed with the siloed care, as you say, at the
Hmm.
expense of more relational presence and
Hmm.
comfort sharing and disclosing. And
Hmm.
honestly, like the term, you're not allowed to even think about the term love, but surely love has to come
Yes.
and be at the
Yes.
heart of a therapeutic relationship, right?
Exactly. Yes. Yes. I agree. I do. And it's something that, a lot of my psychoanalytic mentors mentioned this hard, like, overcorrection in psychiatry to try to gain more credibility amongst our other colleagues, right? And it's like we must make it, and for me, it was very sad to see, because there was a point where I had an argument with someone. I'm like, what is the difference now between a psychiatrist and a neurologist? And have you ever met a happy neurologist who wasn't autistic? Like I just, and they are our cousins. And it drained away. And I think that's part of the problem. And we overcorrected. And because we overcorrected to gain this, it also put blinders up for us, where it used to be okay to have that sort of discussion, that you would cross that boundary of like, you're strange, you're a psychiatrist because you're strange, while you're strange because you probably have mommy issues or whatever. That discussion, no one has that discussion anymore. We don't even play like that anymore, but we all intuitively knew, like, you become a psychiatrist because there's something, there's a thing, there's something about you, there's something about your experience. Like mine was, I have to learn cues. I had to learn people's behaviors because it's a safety thing. And so that's my comfort. On a great day for me is people watching. I like to go to the beach and just sit and watch all their interactions. Sometimes I interact, sometimes I don't, like if I want to. But I love that. And that's why I became a psychiatrist, because I'm like, ooh, I don't care if you have high blood pressure. Tell me about your marriage. you know. Um,
Totally.
so I do agree. And in my last few jobs, so I've been moving up in my career medically, as one does. The interview answer I always give to why I've left employment is, upward mobility. If you want to, get paid market rate as a physician, leave a job, go get another job, right? Get another hospital job. But really the reason was ethics, morals. I found myself losing what made me special, the thing that makes me a good doctor, the reason why people want to see me, my bubble, my light, my joy. It was being drained away by unethical, immoral, illegal behaviors that, as a psychiatrist, we we are like kind of like the lawyers of the medical world. People look to us to assume a lot of liability. And so I would leave a job and go somewhere else because I love mental health. So I'm like, well, I don't care if it's inpatient or outpatient or community at that time. My last few jobs were in medical directorships. And so I was so close to making the change. It's like the patients want it. The psychiatrists are finally like waking up to the fact that we can have fun at work. Like work should be fun. Like, what do you like about medicine? Do you want to talk about cytochromes? Let's geek out about cytochromes. But also it's okay if your patient, like wants to give you a hug, give them a Christian side hug. We were finally getting to that point. The problem is that it has to be a top down. It has to be from the CEO, who's not a doctor and who doesn't care. Mental health, psychiatry does not make money. It's not a big revenue gainer for hospitals. So they don't invest in that. They don't invest in, making an environment cohesive to relax and healing. You know what I mean? They just don't value that. A lot of our administrators are not doctors. They're not physicians. So that's the battle that I came against. And my solution was do it on my own. I'm lucky enough to live in LA, and where, sure, you can launch your own practice, and you'll be successful. There will be people who will come. But I do feel for empathy for the physicians who live like me, lived in Kansas City, live in Iowa, live in places where it is just you're accepted as being your own individual, but it's really hard to impact community to also make the change. They just want you to be the weird one. You be Freud, you be whoever, you be the special shrink. But it's, so I want to start the movement. The movement starts with me, living the life that I'm trying to get other people to see that they can live too, like you're doing now. Like you have your podcast, and that is something beautiful, and it's something interesting, and it brings in your medical side. You know what I mean? It's fulfilling in such a unique way because you're pulling from all these realms of yourself. Anyway.
No. Thank you for that. I really appreciate it. Those are very kind words. And yeah, I totally resonate for sure. I think probably a lot of clinicians probably mid-career get to a point where they kind of look around and they feel, they've lost the imposter syndrome, hopefully, and they feel like look around and they kind of are, this is sort of like me just talking from personal experience. And you sort of look around and feel a bit more confident about making judgments around institutional patterns that you see, and checking in with yourself and saying, okay, well, like, do I want to continue, here and sort of like a cog in this sort of dysfunctional system for another like 15, 20 years, or am I done with this crap, right? Do I want to just like it's not worth take a pay cut, right? If I'm going to be miserable for the rest of my career, like what's the point, right? And so I think that, and I think particularly, with psychiatry, because so many colleagues have just been so frustrated because, you end up in, say, inpatient or outpatient, as with some clients who just have these refractory problems and they can't afford therapy, so they end up on 3, 4, and 5 different psychotropics, and then 2 more to treat the side effects from the cocktail that they're already on. And so that's the other reason why I'm super excited to talk to you a bit about like other methods, like the neural stimulation and ketamine assisted psychotherapy, psychedelic assisted psychotherapy, because that in particular to me seems like a real exciting frontier that can try and bring together these aspects that we're talking about in an integrative way. You mentioned the term integrative psychiatry in your current practice. So I'd be so interested to hear more about that, because I think it's exactly what those of us who have become burnt out and jaded and cynical about the psychopharmacological limitations and the capture, the pharmaco-industrial complex capture that's endemic in terms of the research and all the rest of the training and everything. And a lot of us are just done with it, right?
Yes, exactly. And, I hit that wall too, that many of us do, where you're just like, there's just not enough resources for these patients. They need more than just the pill, and the pills are not enough. And that's really how I started sort of to peek my head into what else can we do. But I always have to preface and say, like, there are most of psychiatry is just keeping people alive, just they're going to be a cog in a wheel, and they just need to numb themselves enough. That's what a lot of people want, which is sad. But they come to a psychiatrist and they're like, it's fine, the med's fine, I don't feel anything, I'm kind of numb, that's great, I don't want to kill myself anymore, I'll see you next week. So there is that entry level psychiatry where it's just like, I just need to stabilize. But something that I stepped into is those people who don't want to do pharmaceuticals for whatever reasons. Okay, well, then you have these intellectual conversations where it's like, well, where did the pharmaceuticals come from? They come from these herbal supplements or these plants. Why can't I just take that? It was patients asking me that. Why can't I just take that? I feel more comfortable. That made me start looking to supplementation, and also I also function on this idea as a doctor that I can tell you all the options. I can tell you what I would do. I would tell you what other people who are psychiatrists may do, like if it differs from the why it is, and I leave it to them, right?
Mhm.
I leave it to them. And in doing that, it made me have to open up to, okay, well, not everyone wants to take Lexapro. Maybe they want to take St. John's wort. And I just have to tell them, like, hey, you're just going to have like a really restricted life outside of that, but I'm open to it. And then they live the experience, and maybe they come back and say, no. Or as a creative, they don't want to be numbed. And so I have to say, well, we're going to underdose your medication. So you're a little bit hypomanic because you want to be hypomanic. And let's say, and they're honest and they say, oh, I smoke a whole bunch of weed. And I'm like, okay, well, here's how we need to balance everything out now that we're doing this. So that opened me up to this. I think it's a spectrum, and it's a lot more fluid than people realize. And we already kind of do it. It's just that we create the blocks, right? We as psychiatrists say, no, I'm not open to that, you need to talk to your primary care doctor or this. But people are always kind of asking for the other. They're asking for, hey doc, can I walk because I'm really nervous? And that's how I got into somatization. The place for psychedelics, honestly, if I'm being honest, as an artist, all my friends, because as the doctor friend, I kind of sit in this like line of like, I can't do the drugs with you, but I'm around you when you're doing the drugs. And because I worked with all these psychoanalysts who are very, they're near retirement. So they were very open about their psychedelic use and how they used it in processing trauma and things. It really opened me up to the fact that like a lot of people could benefit from that integrative experience all at once, because that really is, you're having a spiritual moment, you're having this psychological integration of the, what I mean, you're kind of looking and getting perspective in a different way, and it's doing something physically to your body the same way a medication could. And so that's what opened me up to like, oh, this could be useful. But I lean more towards, working with people in trauma. A lot of cannabis, a lot of cannabinoids and all that stuff has been used, and it's very helpful because we know as clinicians sort of the horrible things that we can induce in people. You want to sleep, now I'm giving you a medication that's a sledgehammer, and so now you have no choice. And as a traumatized person, you don't want to choose, do I stay awake all night, or do I have no agency in what my body is doing, right? And if they come to me and say, doc, I just took an edible and that was just fine, and I slept great, and I woke up feeling good, who am I? Who am I? So I've opened myself up to that. And so that's what helped me sort of in cannabis. And then the psilocybin, really, that's also sort of like a trauma work area too, because especially in Canada, it became like all my Canadian therapy friends were trying to find doctors who were willing to partner with them to do psilocybin assisted sort of like therapy. And so I was opened up to that. And then, on the West Coast, everyone is microdosing and things. And so I was getting more information, and it is useful. Again, having all the experiences all at once, TMS, I think is useful, but it's still in its infancy, and it's very by nature classist and racist, and you know what I mean? Like, who has 40 sessions, who can leave their job for an hour and commute to go sit down for 15 minutes and be zapped. Yes, it's
Mhm.
helpful. We're probably going to need to be on a medication if you really want lasting effects. We don't really, so it's still so early, but it's very helpful. And for the people, I've seen people have benefits to it, but they also are people who were set up to succeed. They're set up for self-actualization, and they just need something to really neuromodulate.
Mhm.
So I haven't seen it be used. And when I worked in the VA, that was a very big push to like get veterans to try TMS. But by and large, they would have like 2 weeks of like, oh, clarity. Like I feel like I'm balanced, not great, not horrible, just balanced. And then ultimately they would have to be back on medications and start the whole cycle again. Ketamine is something that I feel has the most potential, but being in LA, I'm a little bit jaded because it's still same thing with TMS. I don't like anything where you have to lie about a diagnosis in order to qualify to get it paid for, right? So people are saying we can treat autism, but we're going to write it down as major depression, so that we can get it paid by insurance. So that kind of muddies the water too for me for TMS. Ketamine, the same thing. These are cash pay clinics. And so effectively, because there is no forced psychotherapeutic work to process these things as, the structural changes are happening. What ends up happening is like this loop. I feel like a lot of the ketamine providers, especially here in California, end up being drug dealers. We're just giving them K-holes. Like I was a raver in college, and so I'm like, everyone's walking around just a little bit high, and when the high wears off, they go back. And as long as they have the $500 to pay, and so I really do think that these like especially psychedelics have a really profound place in medicine just because we can do so much with so quickly, you know what I mean? Things that take months and years of integration, you can do it all in, a couple of sessions, right? But it's still very young, and it needs to somehow we need to separate, or psychiatrists need to really push for accuracy in, diagnosis and uses and usefulnesses of things, because like we're messing up our own data. We're just making sure that we can get things paid for by insurance, we can get people in the door because we bought this $3,000 machine. We are messing up our own data on what we're actually treating, what's the use. And so I fall back on ECT a lot. I've talked a lot of people into ECT because I'm like, it's tried and true. It is tried and true, and it's not one flew over the cuckoo's nest. You go to a hospital, anesthesia, you wake up, you know what I mean? So if you're at that point that you're thinking about investing millions of dollars in ketamine, then you should go ahead and zap your brain, in this way. So long-winded, but yes, it is useful in the early stages. It's weird. You're in this gray zone as a psychiatrist because people do come to you and they tell you about your drug use, and I have to be honest with them, and I have to like preface it and say like this is off the record, you know what I mean? Like this is not like a psychiatric recommendation. This is me as a human being, human being who has medical knowledge, saying like, okay, if you're going to use these drugs, stay away from these. Use this in moderation. Maybe use this type, if you're going to. So I'm looking forward to a time where we can openly, talk to our patients about these things and not have to worry about, is someone going to report me to the board, or it's someone, you know what I mean? Because it is that gray area, or do it off the books completely. And it's just this cash pay drug dealing situation that it feels like it is in LA.
Yeah. Yeah. Thanks so much for explaining. Those are complex dynamics for sure. And it's in
Yes.
some ways, it's kind of like the proverbial elephant in the room when it comes to, on the one hand, there's a lot of hype and hyperbole, particularly the psychedelic assisted
Mhm.
psychotherapy idea. But I think at least as you say, if there can be maybe some more advocacy for the importance of the psychotherapeutic integrative piece of
Yeah.
it, right? Because that's critical, even
Yes.
though the molecules themselves obviously have an effect, but yeah, because the more that there can be an emphasis on with clinical treatment guidelines
Hmm.
really underlining the importance of the psychotherapeutic integrative
Yes.
component, then hopefully that will, just because even though, as you say, I also find that the mills are distasteful for sure.
Hmm.
You can understand why they come about, just because
Yes.
it's just business as usual. But
Yes.
on the other hand, it's like, because it is driven by client demand. If clients
Hmm.
have more understanding of the importance, like I had this discussion with a client yesterday,
Hmm.
um, and if the consumer has more of an understanding about, it's buyer beware. If the consumer has more of an understanding about, okay, well, yeah, there's this, but I'm not going to get an opportunity to
Hmm.
explore and do integrative
Hmm.
psychotherapeutic
Hmm.
work, and that's less likely to, not only help treat symptoms, but get
Hmm.
me to a point where I'm self-actualized and I have
Yes.
vitality, as opposed to
Yeah.
just not being
Yeah.
anxious and depressed,
Right.
then I'm going to choose to go to the clinic where I'm going to get the
Exactly.
integrative psychotherapy as well, right? Yeah.
Yes, because ultimately people get to that point, you know, fulfillment is something that a pill cannot give you. It's a place that you. And so, yes, I take the same approach that you do, which is I just kind of lay it out like we can do these things, but this is the importance of really thinking about why you're doing it and what you're trying to
Mhm.
get out of it. What do you want different after you do ketamine? Do you want to do ketamine for the rest of your life? Like, what does it mean? Right. And so, yeah, it's moving that way forcibly. I do think that the beauty of being an integrative thinker, an integrative psychiatrist is that the world is moving this way. Sort of like the layer, you know what I mean? The layers are being shed
Mhm.
outside outside of our bubble. And because of that, and because we deal with emotion, it is happening here too, where the layers are being shed. It's no the things that once conspiracies are no longer conspiracies. What is real? Well, reality is
Mhm.
what you make it. So let's name the reality. So that's what gives me sort of the hope that, like, okay, in naming the elephant in the room, maybe we can start actually doing something about it.
Mhm. Mhm.
Yeah. Yeah.
For sure, for sure. And one thing I just wanted to actually put a pin in is something you said earlier on just now, which was this idea about medications definitely have a role, right?
Mhm.
Psychiatric medications definitely have a role. So I think for people who are watching and listening, yeah,
Mhm.
it's, just like I think, you and I would agree that we don't want to throw the baby out with the bathwater, so to speak, in
No.
terms of, encouraging people to stop taking medication or
Yeah.
avoid medication, because they definitely have a role. But as you said earlier as well, like these are part of what is exciting, because the toolkit is expanding, right? So the
Yes.
toolkit is
Yeah.
expanding, and it doesn't necessarily need to be, like you were saying, a siloed approach where, oh, I only
Mhm.
prescribe XYZ medication, or
Mhm.
I only
Mhm.
do XYZ psychotherapy. Of course, you're going to have areas where you feel more competent and you're more
Right.
interested, and that's totally fine. But at least to have some awareness, like, okay, well, if I'm not familiar with, or I don't have the training in like a neurostimulation technique, then I know where to refer you on to. But at
Yes.
least to have this toolkit that is expanding, and so there are neurostimulation, as you say, TMS for sure, it's out of reach for the majority of folks, and that's a big problem.
Mhm.
But maybe other, if the depression is not as severe, maybe TDCS, and something
Yes.
that's a bit more, accessible for people. And then
Access.
on the psychedelic assessment, sorry, integrative psychotherapy side, yeah, a harm reduction approach for sure, right? So, and then how do clinicians sort of navigate those concerns around, oh, it's a gray market kind of thing. Can I actually give this advice? How do I do it kind of like, on the DL sort of thing? And
Yeah.
and so it's really, it's interesting for sure, right?
Yeah.
It makes the job challenging, but also exciting at the same time, right?
Yes, and it's really, and that's what makes it fun. Like, I feel like as psychiatrists, we live on the frontier of medicine. You know what I mean? There's not a lot of course, like hardware and things get improve in other aspects of medicine. There's new drugs and things, but we always live on that, like that edge of the human frontier. What is next? What does, like we feel, and we help people navigate the changes of society, right? And I agree, like medicine is a tool. And the thing is, it's a tool that makes life so much easier, if used correctly. Like I have to remind people, it's like, yes, you will get there. We will get there, just talking about it and feeling the pain and journaling and all that stuff. It'll happen. But man, it can happen a lot faster if you just slept or ate, or you weren't manic or cycling or whatever, or hearing voices, like life can be so much easier. And we have that tool that no one else has, so if I try to like remind myself of that, and that's what gives me the excitement. I may not like what's going on now, but I can be part of the change by naming it and steering the narrative. So yeah.
One of the things that struck me as well is when you're talking about the, some of your thoughts on psychedelic assisted psychotherapy, it made me really, because I've become really interested in that, and I've done workshops and retreats and tried to
Same.
train myself to get a better familiarity with it. And one of the common threads, and I know it was when you talked about how the plant medicines, the traditional plant medicines, and the interesting role that they have, and the appropriate role that they have, and is the common thread that I've noticed, and I think is really crucial, is this idea of the sacred nature of the whole practice, I suppose you would say, right? And so how there's a real importance to recognizing and fostering that sacred nature of I guess, what would you say, the therapeutic process,
Yes.
and how that allows for this sort of like innate inner healer to sort of be able to kind of like work in the background, right? Or be allowed to sort of flourish, where that's, I think, really been missing in sort of more contemporary legacy mental health psychiatric kind of training and practice, right?
Yes. And that was the role of the psychologist, is really fostering the importance of like the sacredness of the therapeutic bond. It's so sacred.
Mm,
And so in feeding that initially and naming it and feeding that, that's where the love comes in that you talk about. You
mm,
have to show love to keep something pure and, honest and open. And that's where the healing takes place, and you don't have to do anything but come and name the specialness of it. And that's why a lot of people, so the shift during the pandemic to telemedicine, it really also harmed psychiatrists too, because even if you had a psychiatrist who, just gave you 10 minutes and refilled your meds and never asked you questions or anything, there was something about them giving you space,
mm,
physical space, opening the door, fixing the couch, making sure that you're comfortable. Those little micro, movements, moments, those are the things that create that therapeutic bond of like, we care, so
mm,
the pandemic kind of put a hard stop to that, where like we're doing this over a screen with people and we're emotionally, distant and not attuned. And so it's like, what is it? Then people are seeking answers from everyone. And that's when you get patients who are like, well, Joe Schmo down the street, the life coach said I should do this. And, because Joe Schmo gave them the sacred space,
mm.
process, to think, to dream, to worry, whatever it may be. So we do need to get back to that. But that's a healing that, I don't know. I think because I was forced to be in therapy to initiate my therapeutic journey, like it was a crisis that initiated my own therapeutic journey. I have a different perspective because I understand why there is such a disconnect if you've never been forced to be vulnerable in therapy. If you never had to be a patient at a time where you weren't seen, like you weren't Dr. So-and-so, because there
Mhm.
is a big shift. Once you become a physician, people treat you differently no matter what. But before then, if you've never had a therapeutic interaction, as a patient, not a physician, you don't really get the importance of it. We have micro moments of it, but it's mostly image based. When I go to my doctor, I'm like, you're my colleague, but also my doctor, and I don't know how much to share because I'm going to see you professionally, you know?
Mhm.
Um, so I think that's also something. So like I really do push for, you know, psych residencies to have like to make people have like we have therapy. We need to have therapy. You can't be a good
Mhm.
therapist if you never actually sat in the seat and had to be vulnerable and know like, oh my God, this is what it feels like to have this trigger, to have this response, this automatic response, you know. Um,
Mhm.
yeah. So I was lucky enough to have that in residency, and that was the blessing of, you know, Kansas City's my time there is that I did have a really phenomenal education as a basis that expanded, you know, over time with just different environments. Yeah.
Mhm. Yeah,
Yeah.
it's cool to hear about the experience in that you had in Kansas City because it reminds me. I mean, I don't know, maybe I'm projecting, but when I got matched, it was to, I grew up in Vancouver on the West Coast and I got matched to Halifax on the East Coast. And I was
Mhm.
excited, but I was also not too sure about what to expect. It's a smaller
Yeah.
town, this and that. But it really was a blessing in disguise because you got exposed to a whole really awesome community of
Mhm.
clinicians from psychologists, psychiatrists, to social workers, to everyone, nurses, and everyone was just, it was just an awesome team. So
Yeah.
it sounds like maybe you had a similar kind of experience there in Kansas
Yes.
City.
Yes. Same thing with like, you know, medical school. I went to medical school in Blacksburg, Virginia, so in the Appalachian Mountains, in the heart of the Appalachian Mountains. And honestly, I just chose my medical school because I like it was pretty. And but those because it was like away from everything and everyone there was genuinely there as a healer, you know, and being a healer taught by other healers is very different from someone who's just doing working going through the motions. They will tell you how to be productive, but I don't want to learn how to be productive. I can be productive. That's what pre-medical school is. It's just like, how can you deal with intensity? Yes, I can deal with intensity. I need to learn how to blend that intensity and that knowledge and my nerdiness with like what makes people human quickly, you know what I mean, like.
Mhm.
And that's the skill that I'm trying, like I'm growing, is like how can I be the best psychiatrist naturally and quickly. Like I just and it should come in and come out. It's part of me, it is me. It's not something that I want to hide anymore, you know.
Mhm.
So yeah.
Yeah, for sure. I'm also respectful of your time. Are you okay
Yeah.
for another 10 minutes or so?
Yes,
Just
yes, yes. We can do another 5 minutes. I'll go pick up my kiddo.
5 minutes.
Yeah.
Okay, 5 minutes. Yeah, that's cool. We'll wrap up in a sec here. It's such a great conversation.
Yes.
100%. I mean, I've been in therapy myself, so it resonates
Yeah.
for sure what you're saying about coming to terms with various different experiences that a caregiver or a clinician has had, and just understanding that the more one understands about one's own challenges, then we can translate that into, perhaps being in a situation where we can really truly be empathetic towards someone, right? And share in that sacred space, as you say. Maybe to wrap up, we can talk a little bit about then, so this concept of self-actualization and seeking vitality,
Mm,
maybe you can just help us to explain, so where have you landed in terms of how you're trying to bring your wisdom and your knowledge and your passion into that combination of medical psychiatric practice with your artistic work in
mm.
order to help people flourish.
Yes, something that became very clear to me moving through my career is that high achievers, you know, the medical model as we have it right now does not, you know, for mental health does not serve high achievers because the medical model just looks for stability. You know, are you a danger to yourself or others, right? And are you getting somewhat better? The goal is some sort of growth. It's not, you know, the growth that you want in particular. And so I was finding these people saying my life on paper looks good, but I don't have joy or meaning. I don't know why I'm doing the things that I'm doing. These sort of like existential questions. And I had to put a name to it. Was like, oh, okay, you need to integrate in order to self-actualize. You need to be able to, you know, we need to separate your productivity and what you look like, you know, on 2D with how you're feeling 3D, you know. And so my that has been, I saw there was a need for it, and it's something that I've also sort of needed. I needed to have those discussions. These are discussions I wish I had with my psychiatrist. These are discussions I wish I had with my own therapist. Like, why are we here? What is the meaning, of it all? What gives me purpose? Besides paying bills, I can pay my bills. Everything is good on paper, and so that's how I was inspired. And what I try to do is meet people, and what we all should be doing is meeting people where they are like ready to expand. My own art, I use it because it was my healing, I use it as an example. So I will show people I wrote a book because my therapist actually told me to. She was like, "You're writing. I needed to process a specific trauma. And so I wrote it as a chapbook. And for my own self-esteem, I submitted it to see if it would garner any sort of like award. Is it good enough in other people's eyes?" So I try to guide people through their own sense of meaning outside of productivity, outside of, sort of like the social things. I mean, like, kind of think about how many psychiatrists, how many physician friends, who have perfect lives, but are unsatisfied and alcoholics, cheating with the nurse at the hospital because they needed a rush, right? They're chasing dopamine. And so, yes, I try to get people to the place where they can feel free to be vulnerable and not have to sort of keep on the image because they're slowly just decay from the inside.
Mhm.
I don't know if that answered your question particularly, but yes.
100%. Yeah, it really did. And
Mhm.
really interested to hear about your book. Is that something that people can pick up a copy of, or what's
Yes.
the? Oh, that's
Mhm.
fantastic. So maybe
Mhm.
can you just show it to us on the
Oh,
screen
yes,
there? I'll
yes,
put
yes,
links
yes.
in the
So this
show
is,
notes.
yeah, swallowed words. So this is a chapbook that I wrote in, and I released it in 2022. Yes, 2022. So like I said, at that time I was processing sort of my maternal trauma. My mom being my primary caregiver was also the most like emotionally and physically abusive to me. And so this was my sort of processing that. And like I said, I thought, okay, let me just see if other people would want to read, and it did resonate. And so, and it built on that too. But yeah, so that was part of my healing. Mhm.
Thanks so much for sharing that. And so yeah, we'll put links in the show notes to where people can
Yeah.
find Dr. Ekeanya's book and any other aspects of content in her clinic, anything else that is there. I'd really encourage you all to just check that out. It's going to be really helpful and inspiring. Dr. Nora Nneka Ekeanya,
Yeah.
thank you so much for talking to me today. It was just lovely. Just so glad to have met you. And it was such a powerful and deeply thoughtful conversation. What really stood out to me is that mental health care doesn't end with symptom reduction, right? It actually, in some ways, begins there, right? And
Mhm.
the real work that we explored today lies in this integration, right? Identity, meaning, creativity, the sacred, love, bringing together the biological with the psychological and the spiritual, right?
Yeah.
So thanks so much once again. Just really, really appreciated the conversation, and hopefully we can do this again sometime.
Yes, I'm looking forward to doing it again. I really appreciated the time and the space and the platform. Thank you so much.
That's great. Okay, thanks again. Take care. All the best.
You too.
Okay.
Bye.
Okay. Bye-bye. Bye. Bye. Thanks, Nora. Thank you so much for joining us today on the Neurostimulation Podcast. I hope that you enjoyed this exploration into the fascinating world of mental health and neuroscience and neurostimulation as much as I did. If you found today's episode interesting, don't forget to like and subscribe to the podcast. It's the best way to make sure that you never miss an episode, and it also helps us to reach more curious minds like yours. Also, if you think that today's episode might resonate with a friend, a family member, or a colleague, please share it with them. Knowledge is better when it's shared, and you never know who might find this information helpful or inspiring. For more details about Dr. Ekeanya's work and all the aspects of the psychiatric care, mental health care, and the technology that we discussed today, Please check out the links in the show notes below. You'll find everything that you need to dive deeper into the topic. And I'd love to hear your thoughts, so please join the conversation in the comment section or reach out on social media. Your questions, ideas, and feedback make this podcast better. Finally, don't forget to tune into the next episode. It's going to be another exciting journey into the cutting edge of neuroscience. Thanks again for listening. Take care, stay curious, and I'll see you next time on the Neurostimulation Podcast.